My name is Curtis Andrews. I'm an osteopathic physician here with CopperView Medical Center in South Jordan, Utah. We are a private practice clinic of internal medicine, pediatrics, and urgent care focus. Myself, I'm an internal medicine and pediatrics trained physician and been here coming up on 10 years now. So we primarily serve, we have a big suburban population here in South Jordan. We have a mixture of a lot of Medicare age patients and then a lot of even Medicaid population, and then a lot of private pay commercial insurance type population as well. A lot of our patients also speak multiple languages. We have a lot of Spanish speaking folks here, and then kind of a contingent of Vietnamese and multiple other languages that we serve. So that definitely adds into the challenges with culturally with managing medical illness. Oh, Danielle, you're muted.
Okay, so could you describe a little bit more specifically about the patient population that you serve? I know you mentioned Spanish speaking and Vietnamese population. Could you go into a little bit more detail?
Sure, prompt me a little bit. What sort of detail do you want?
Just like, do they come primarily from South Jordan, or are there other locations that they come from?
So our catchment area is a lot of South Jordan, West Jordan, just being specific of the cities in this area, Harriman, Riverton, Bluffdale, a lot of West Valley, Magna, Taylorsville. That's kind of the big population. We get a smattering of folks from kind of the east side, Sandy, Draper, and every now and then down around Saratoga Springs. So quite a large catchment area, but mostly kind of focused right here in the South Valley.
Wonderful. And next, how does your clinic leverage electronic health records to identify patients with uncontrolled or possibly even undiagnosed hypertension?
So we definitely use the EHR. It's our lifeblood. We have some flow sheets that are built into the electronic health record so that we can quickly access that in the middle of a progress note and see, a history of blood pressures. We kind of have some, I don't want to say protocols, but we just have some routines built in where we take a look at that, especially if patients are on medications that might put them more at risk for hypertension, or especially if they have other conditions such as diabetes or chronic kidney disease where hypertension is a big comorbidity. Then we have flow sheets that kind of automatically cue us into reviewing their blood pressure history.
All right. And can you describe some features of the clinical workflow for patients diagnosed with hypertension?
Yeah, so on diagnosis, generally typical lab work type stuff is done, metabolic panels and the like, as is just standard. But then we have a machine that does blood pressure averaging. So we'll take 6 blood pressures and average them, and to try to get close to a 24-hour blood pressure average, which is the standard for diagnosing hypertension. So that helps a lot with those patients that are kind of borderline, and also trying to rule out the office-based high blood pressure diagnosis. A lot of folks come in with the quote white coat hypertension who aren't truly hypertensive, and they actually get better on repeat testing. So we use that a lot to try to weed out those who maybe don't need medication, or to find those who really truly are hypertensive, and it's just getting missed, I guess.
All right. And moving on, what are you most proud of about your clinic staff and the teams that you work with?
I think our staff, both medical assistants who are putting patients in the room and checking blood pressures, as well as each of the providers. We have several physicians and then multiple advanced practice clinicians, NPs and PAs who are just tuned in to doing the best thing for their patient, and looking at blood pressures and not just ignoring them because, hey, maybe they don't want to focus on that today, but they are taking things seriously. And the medical assistants are good at repeating blood pressures. If they see something abnormally high, they take note of that and they'll repeat it automatically for most situations. So that's really nice. It helps us as clinicians to know that everybody's working together.
And what are some challenges with helping patients to manage their hypertension and some challenges that you face within the clinic?
So multiple challenges. There's definitely compliance with prescription medication or just prescribed treatment plans, which might be dietary, exercise, stress mitigation, those sort of things. Getting patients to take ownership of their diagnosis and manage it themselves in ways that aren't a prescription medication. That's always a big challenge because a lot of these things can be treated without taking a pill. But you have to convince somebody of that, of course. And then compliance with prescribed medications when it comes to that. I think averages is most patients take medications about 80% of the time, and sometimes that's not enough to control their disease process. So we have a few other ways with some Medicare Advantage programs or whatnot. We get some data on when patients are filling their prescriptions. We get some flags as to when they're not filling their prescriptions, and we can reach out to those patients individually and call them and say, hey, what's going on? You haven't filled your medication this month. And try to catch those who might be missing out on medication compliance.
Do you find that any of your patients mention any barriers that they have with medication compliance or picking up their prescriptions or filling them?
Cost is always a big issue. We definitely try to use a lot of low-cost medications here. We don't jump right to the name brand stuff as a rule. And so that we try to help that way. We try to do 90-day prescriptions or 100-day prescriptions, depending on the insurance plan and their preference. Those help a little bit, but definitely cost is an issue, especially if we have to use those name brand medications. That could be a big problem. Every now and then you come across somebody who has transportation issues and they can't get to the pharmacy in a timely manner. So using, mail delivery pharmacies or trying to coordinate with family members to help get them to the pharmacy to pick things up. Those are just the more challenging parts of our day, I guess.
And then what changes do you anticipate in your clinic in the coming weeks, months, following years, and that may impact the clinic's management of patients with hypertension?
Well, I don't know about the very short term, but I think long-term electronic medical records are getting better, reporting is getting better. So maybe communication with pharmacies is getting better so that we can have an easier way of tracking what our patients are doing and we're not kind of behind the game. So if we can see more real time what patients are filling at the pharmacy, it might help us react sooner. And that can definitely help patients be more compliant with their treatment plans.
And then one additional question from Rebecca: how did your clinic foster a team-based approach to the work? Often we hear that there are too many other initiatives or not enough time. How is your team finding the time?
So yeah, I mean, for your standard visit, there's so many things that you're supposed to do in a 15 or 20-minute visit, and it really is daunting. And I think we do regular meetings just as providers, and then we do also regular meetings with our medical assistant staff, and we just try to reiterate those things that are most important. In the end, just taking care of the patient. And I think just repeatedly bringing up certain initiatives, certain things that we think are the most important is what helps keep it on everybody's mind, instead of getting muddled down with maybe some other things that might have a less importance, I guess. Hate to say that word again.
All right. And then you mentioned home monitoring. Can you speak to the clinic's approach to home monitoring?
Yeah, that's a big challenge. Definitely, in the ideal world, patients would have a blood pressure cuff that could communicate to us wirelessly, and we could see what their blood pressures are doing. Right now, it's really hard and not necessarily something that can be done easily. We have a patient portal where patients can send us messages and give us updates on their blood pressure. I'm working with somebody right now who's going through some medication changes, so every couple of days they'll send me updates on his blood pressure, and then we can make some small tweaks out of the office, which he appreciates for sure as a busy professional himself. But hopefully in the future there will be more access to ambulatory blood pressure monitors where we can have that communication right to the electronic medical record.
And what do you think is a promising practice for managing patients with hypertension in your clinic?
Promising practice. John, give me more.
What it ties into a question from earlier, but what's working particularly well, or is your go-to, okay, here's how I think this patient could better manage their hypertension?
Gotcha. I'm pretty straightforward with my patients, and I just kind of tell them how it is. And if we see a pattern where it's I'll just ask them, hey, how many days in the week are you actually taking this medication? And most patients, when you ask them straightforward, will say, maybe get it 4 or 5 times a week. And then we can talk about that and how we might be able to overcome that barrier. Or we talk about cost straightforward, or we'll talk about diet and exercise and maybe what we're doing, with therapeutic lifestyle changes that might be impacting things. And so I think just patients appreciate being talked to as real people and us understanding their real challenges. And that's what I try to do personally. And I think all of our physicians and PAs and NPs here do the same thing. We have a really good group that does that.
Great, thank you. And does anyone else have any other questions for Dr. Andrews here? Yes, so what types of tricks or recommendations would you have for other clinics or professionals working with patients with hypertension?
One of the things above and beyond just the interpersonal communication with the patient, I think that's really helped us is getting this blood pressure monitor that does blood pressure averaging so that we can have a patient in a room isolated by themselves away from the physician or the scary people. And we can check their blood pressure 6 or 7 times, have that average and let us know really what a blood pressure might be, an estimated 24-hour average blood pressure. That's been really helpful to kind of either show the patient confirmed hypertension, or kind of rule it out in those that might just have that office-based hypertension. That's been helpful in our clinic the last couple of years. And I think anybody who's not using it could benefit from doing that. The other thing is, I wish there was more availability to true 24-hour blood pressure monitors and that sort of thing. So if folks know how to get a hold of those, I know there's just a handful kind of in this valley and through some of the big hospital systems that we really don't have access to. And that would be another big help in treating people appropriately. So definitely sharing access to that or developing more access to that sort of thing could be helpful. And I think as electronic medical records get better again, we can get better data from pharmacies. Hopefully down the road, we're going to have more bidirectional interface with pharmacies where we can figure out what patients are filling. And I think that'll also be a huge help. Quick question came up about how do we fit in using averaging the blood pressure machine in the clinic flow. Quite frankly, if I've kind of trained my medical assistant and some of our others that if somebody's blood pressure is high a couple of times and they don't have a diagnosis of hypertension, my medical assistant just puts it on them and they will go ahead and do that before you even get in the room. And so as most doctors, I'm usually a few minutes behind, and it works out just fine that they're getting some screening done while I'm finishing up with another patient. It works out pretty well.
All right. And any other comments you have to say about who you serve, about your clinic in general, or just anything else that you would like to add?
Oh, I don't know. We're just we're happy to be asked to do this, and it's fun to talk about things that we do every single day and try to make it exciting. We're a fun clinic, small little private practice clinic there aren't very many of us around anymore. So we're happy to be doing what we do and treating all the patients that we treat. And thanks for letting us be a part of this today.
Wonderful, thank you. And thank you for taking the time to do this interview with us so we can share it with the rest of the state.
No problem. Thanks, Daniel.